Right, hi everyone. So I'm Rebecca Scott and I'm the Public Health Principal for Public Health South Tees. So I'm just going to give a little bit of an overview of health in our policies and then I'm going to pass on to David. So next slide, please. Hasn't moved for me.
There we go.
There we go. So why health in our policies and why now? So I think it's important to know that and to remember that health isn't just about the NHS. So most of actually what shapes people's health are things like housing, transport, education. So things that sit outside healthcare. So if we want to actually improve outcomes, we need to take a wider look. Locally, I'm sure everyone's aware, but we've got a problem with stubborn and widening inequalities. For some places, life expectancy just isn't going in the right direction. And that's not just down to bad luck for South Tees. It's about the conditions that people are living in. But we can't fix that with just medical treatment alone. So this isn't new for local authorities. So local governments have been part of public health since the days of clean water, sanitation, the first big outbreak, one of the first big outbreaks that's recorded, which was cholera. So it's in the local authority DNA. Even if it did take, even if we did go into the NHS for a while. So we did go into the NHS for a while, but public health came back to local authorities in 2013. So those of us who were there to remember the transfer. And it gave us back those levers that shape the wide determinants of health. With a chance really for us to look at shifting the focus from fixing illness to how we prevent it. Yes, in local authorities, we do have financial challenges, but investing in prevention through things like planning, education and local services help reduce the demand on the NHS. It gives people a better quality of life and it does bring cost savings. So health in our policies is about making health everyone's business. So it's not just a bolt-on or a public health afterthought. It's around us building health into our decision-making processes. Next slide, please. So why now? So building on from what we've just said, what makes it the right time now to push health in our policies forward? First off, it's around working with the council's priorities as they are now. It's not about making everything a health programme. It's about aligning our existing goals. So we're 10 years into local government, holding the statutory public health duty. So we're done with the embedding period. And now it's time for that integrated action. So moving from just managing services to really transforming how we work across the council. But it does depend on the success. But the success of it does depend on how well we're embedded. It's not just public health alone. We need to do it with a wider council, and we need to really embed health into decision making everywhere. So planning, licensing, transport, procurement, all of it. Okay, next slide, please. Okay, and from the last slide as well, just health and wellbeing boards do have a really big role to play here. So health and wellbeing boards are really the place where people come together. So we have the right people who can identify the opportunities and can agree to act. Okay, so what do we actually mean when we talk about health in our policies? So its core, health in our policies is about shifting how decisions are made. So instead of treating health as something that the NHS or public health can deal with, it's about asking, what impact will this decision have on people's health and health inequalities? And how do we factor that in from the start? So not just kind of see what the health outcome is at the end. How do we start thinking about what the impact on health is going to be at the start? It's about embedding health into the heart of decision making, not just a bolt on afterwards. It also helps us spot problems early on. So if we start thinking from the start of something, how is this going to impact on health? We can look at how it might possibly impact on widening health inequalities, and then look at kind of how we can fix those harms. And I think on this slide as well, the quote from the World Health Organization just really sums it up. Okay, next slide, please. Okay, so why is health and our policies the health and our policies approach such a good fit for local authorities? because I think it reflects the world that we're living in. So councils and partners, we've all got lots of different priorities at the moment: housing, budgets, climates, jobs, and health isn't always at the top of everyone's list. But the Health in All Policies recognises that, and it works with it rather than against it. It's about finding those win-wins. So it's about building health into other agendas so we can meet multiple goals at once. Think better housing design that supports health, carbon reduction, lower energy bills. It's joined up working, so it's not extra work. And I think following COVID and what we experienced in the pandemic, it's a smart way to think about recovery planning when we've got limited resources. So it helps us build back better in a practical way and not just kind of the slogan. Using the levers that we already have to create healthier, fairer, and more resilient communities. Next slide, please. Okay, so why is it important? And I think if you can look at this slide, I think it's evident that we're not starting from a level playing field across South Tees. So in South Tees, people are living shorter lives, and many of them are spending a lot of those years in poorer health compared to lots of different parts of the country. It's not just about individual choices, it's about widening conditions. It's about the wider conditions people are living in. So poor housing, insecure jobs, food insecurity, lack of green spaces, and services that are harder to access. So that's why health and all policies really matter. It can help us fix this without just treatment alone. And I think if we really want to close the gap in life expectancies and improve the quality of life, then this is the shift that we need. So slide 7. Next slide. Okay. So how do we move from good intentions to action? So health impact assessments are one key route. They give us a structured way to help identify and build health into decision making early on. Before decisions are made, they highlight risks, spot opportunities, and make health clear in cases to decision makers. Start with the health links, which are obvious. So looking at planning, housing and transport, and the usual places that we can get our easiest wins. Make it a win-win. So instead of kind of leading with health in terms of what matters, looking in terms of how health might save cost savings. It might not be a priority, but we look at the efficiency and the impact that those decisions will make. And we need to make it easy as well. So we can't expect everyone suddenly just to become experts. We need to give them clear tools, templates, and training. Okay, next one. Okay, so making the case. So why is it everyone's business? So I think the take home really from this is that every decision is a health decision. So whether or not we're looking at designing bus routes or housing planning, the choices that we make do shape the conditions in which people live in. If we build health early into decision making, then we'll stop crises and prevent them later on. But it only works if we do this together. And I think the diagram says it all. It touches on every part of the local the goal around shared responsibility, shared benefits, not adding pressure to other teams, but showing really how we can all impact on better health outcomes. Okay, and the next slide. Okay, so for local action, I'm just going to pass you on to David now for the rest of the presentation.
Good afternoon, everybody. So thanks for that, Rebecca. So I'm going to build on Rebecca's start on HIAP. So as I mentioned at the beginning, I'm a public health spatial planner. I'm also a researcher in social biology at the University of Essex. But my role here at Middlesbrough and Redcar and Cleveland is as a creating active and healthy places lead. So when I took this post up a year and a half ago, one of the bullet points on my job description was to embed a health in all policies approach in planning and transport planning decision making across South Tees. So I'm going to go back a little bit and revisit some of the points that Rebecca made at the top of the presentation, but then I'm going to give a case study of what HIAP means in planning in particular. And then hopefully, maybe in questions, we can talk about how we might generalize that case study to other departments in the local authorities. So this is from the Town and Country Planning Association. Basically, just to build on Rebecca's comment about the extent to which these wider determinants are really the key. These are the levers at our disposal that we have access to within local government. So to what extent can we affect the good homes, the access to parks and green spaces, the safe routes for walking, as well as jobs, schools, and other vital infrastructure. Now, there's always a danger, and I think Rebecca kind of foregrounded this, about this concern of health imperialism across all of the different departments or directorates in a given local authority. So one of the important aspects of this is understanding that the agendas of these different directorates, the agendas of these different departments need to be taken into consideration. So terms like inclusive growth are also used for having a HIAP approach. But at the heart of all of that is still this Marmottian, so Michael Marmot's proportionate universalism. So you'll be familiar with the wider determinants of health and all of the work that Marmot's done in that area over the decades for various governments, both blue and red. So but if we focus just a little on some of those key areas there, what we're going to look at is what do we have influence over that will provide opportunities and give people abilities to achieve their personal goals, meet their individual needs, and deal with the changes in their circumstances. So again, another something you will have no doubt seen is Barton and Grant's health model, health map. And some of you may have come across this quote from the NHS, that the opportunities for health are influenced by factors outside of the health and social care system. It's the causes of ill health that they can enable individuals and societies to flourish or not. And by addressing the role of both the physical built environment and the social factors which shape neighbourhoods and places, we can have a big impact on people's opportunities for having a healthy, long life. Now, looking at the Barton and Grant illustration, the Barton and Grant figure, my responsibilities lie in those deeper blue, so the built environment, the natural environment and activity section there. But obviously that the overarching section to do with the climate stability and biodiversity is a big factor, and obviously the built environment has a significant impact on those elements of the global ecosystem. So whilst my responsibilities within the council, both at the local authority level, but then the contributions that I make to the national discourse on this is about those three layers in that level there. So what I'm going to do before I go into the specifics of what we're doing here in South Tees, I'm just going to step up to that global level and look at WHO's work in this space. So actually the WHO kind of lead the HIAP agenda internationally. And some of you may have seen these illustrations before, but I'm just going to walk us through this particular one just to ground. I mean, again, you'll have an intuition about the extent to which it's a complex picture, but I'm just going to ground the work in the view of WHO of what a health impact, a health and all policy approach is at this level. So if we look here, you can see that internationally, 1 in 8 deaths is linked to air pollution and the exposures to toxic air. So in the view of the WHO, if we want to tackle that, there needs to be basically a combination and a collaboration across all of these different sectors. So obviously clean energy becomes an important part of that. So the extent to which we stop burning carbon will obviously have a big impact on air quality. Housing, which is one of the areas obviously my responsibilities within the council has a direct impact on, but also industry. And then we go down to transport. So obviously the extent to which we can create new places or develop our current infrastructure to promote modal shift to active travel options has a big impact on air quality. And then again, the general urban planning of in the first instance, our towns, but then in a broader spatial level, our region will have a big impact on the air quality of our communities, as well waste management. And then again, because this is at the WHO level, they're talking about these local and regional authorities, and finally health ministries. The final quote there, that the health sector drives conversations within all the sectors to keep good health at the top of everyone's agenda, everyone's mind. Obviously, in our particular context here in England, it is the health sector, but very much a local government level through population health and public health. Now, I'm going to speak very briefly about this particular tier of government before I talk about the local government tier. So by April 2028, so within the life of this HDRC, the elected mayors will have a new duty for health across their respective combined authorities. So these strategic authorities will have other powers devolved to them as well, including those to develop the spatial development strategies for their respective spatial areas. So this is a changing environment at a policy level nationally, which we'll look at in a minute too, but also with the obvious the restructuring of local government. There are going to be new opportunities for us to influence health at these higher regional levels, so that we'll be able to have hopefully an even greater impact because of the tools that we will have in our toolkit to affect new development that promotes human flourishing. So that's going to be what the world in it, oh, not the world, what our environment in England will look like by 2028. But presently, as Rebecca explained in her introduction, public health duties sit with the local government tier in England, and in Scotland, I think it's actually within, and Wales, it's both within the NHS. So within the UK, there is a local government association network group called Health in All Policies, of which I'm a member. Some of you here on this call may also be members, but there are also other working groups that I'm a member of. So Spatial Planning for Health Workforce, Healthy Places Peer Support Group, and all of those groups, their agenda is putting front and center the extent to which we can have an impact upstream on policy development at a national level, a regional level, and then at a local government level. But I want to also just broaden the picture out a little bit and talk about that international level again, so the kind of WHO level. So here we've got Sandra Whitehead, who's kind of one of the leading authorities in this space in my discipline of spatial planning. So again, just to repeat what Rebecca said a number of times, and I've also reiterated, basically a health in all policy approach is to get people thinking automatically about health in projects and plans to create co-benefits. But do you know when you're done and what you've accomplished? So that's really important. And Rebecca's mentioned that one of the mechanisms, one of the tools in our toolkit is the HIA. Now, toward the bottom, if you look at all the people that have put their thumbs up to that, the first of the people who put their thumbs up was Reingen, and Reingen Piper is one of the leading lights in the UK when it comes to this agenda, in particular the development and use of health impact assessments. So, and Reingen is, well, apart from being a good guy generally, he is very smart about the ways in which we can develop these tools in local authorities, but also what is it that in particular we should be thinking about and focusing our limited resource on our limited capacity, So just to give you a bit of a big picture, there are only about 40% of local planning authorities in the UK, of which there are local planning authorities in England, of which there are about 330 at any one time. There's sometimes a few more, sometimes a few less, depending on the number of development corporations that are currently active. But Rheingen works with those of us in local government that are looking to develop new health impact assessment toolkits. And one that he was instrumental in creating was this one in Wakefield that was adopted at the time I took my post up here at Middlesbrough. And the development of this particular toolkit was with Rheingen and colleagues at Wakefield Council. So that would have been John Wilcox. And John was very generous as this was under development. He allowed us to work with him and then basically build on the work that they'd done with Rheingen, and work with colleagues in our area. So working with colleagues initially with colleagues in planning, transport planning here in Middlesbrough, but eventually I'll be working with colleagues in the respective departments in Redcar and Cleveland too, to develop our own HIA toolkit. But that's all, and that has to be understood in the bigger policy picture of the local plan, which is currently at the publication stage here in Middlesbrough. Now, I won't presume that you know what local plans are, so I'm just going to give you a very brief definition. It's a strategy document for covering a period of about 15 years that sets out what can be built in the area and where building can take place. So these are really important policy statements that local government level, that local authorities make about their aspirations and ambitions. And part of our vision in Middlesbrough is that residents will be healthy and well. They will be able to easily make healthy lifestyle choices and have access to good quality, safe and well-designed open spaces and networks which encourage physical activity. So we've worked with colleagues in planning and strategic policy within planning to ensure that throughout this document, so I was invited to write a health in all policy assessment of a previous draft of this document before we got to the stage right now, which is Regulation 19. So I wrote a HIAP assessment of the Regulation 18 submission, and we have developed. So I was, again, working with colleagues in strategic policy. I wrote this policy, which will be one of a whole raft of policies in that local plan. Now, I won't expect you to look at all the detailed elements of this. I'm just going to draw your attention to this aspect at the bottom here to do with the health impact assessment. So moving forward, once this local plan is adopted, all proposals, first of all proposals over 100 dwellings will require a HIA to be completed. But as important, towards the end of that paragraph, you'll see that we've also got the provision that we, as it says here, local planning authority, but we will have a joint officer working across public health and the planning authority to ensure that any planning application that comes across that is registered in Middlesbrough, if it's in an area where there are sensitive receptors that we're concerned about, or if it's a particular use that we have concerns about, we're in a position to be able to require a health impact assessment to be conducted before, at that stage, of the earliest possible stage in the process. So what is the health impact assessment? So here in Middlesbrough, it's just about finished. It will be adopted when our local plan is adopted. There are, again, to go back to Rebecca's introduction, but things you're already familiar with. If you've got any idea of Marmot's wider determinants, basically all of the wider determinants are themes throughout our HIA. So we've got housing, we've got physical activity, movement, we've got transport, we've got the food environment, we've got air quality, we've got crime, healthy high street. So all of the things that we know have a big impact on the people's opportunities to flourish and address those issues of health equity in a given place. So I'm just going to focus on one of these themes for this brief introduction. So if we look quickly here, every developer will have to engage themselves a health impact assessment assessor to conduct this assessment on any design proposal coming forward. So on the left-hand column, there are a series of statements and questions, and there will be every submission will have to have a position on each of those statements when it comes to the extent to which they promote or they're a barrier to all of those things that we know, we have evidence for has a positive impact, and also the extent to which they've mitigated any of the potential negative impacts of their development. And then on the right-hand side, you can see that we'll for each of those themes throughout the whole document, they'll also have to be explicit about how they've come to make their assessment, but also the extent to which they think they're having a considerable net gain. Is there a considerable net gain in terms of public health, or if there's a considerable net loss as a consequence of the design that they're proposing? So this is our mechanism for ensuring that there's a positive health impact by any development coming forward, and this mechanism is written into the health policy at the appropriate level, which currently is at the local plan level, but this may, in the future, post 2028, may actually be at a different level. It may go up that tier to the combined authority level. So just to drill down very, very quickly, not only do we have those things written into the policy now in Middlesbrough, but we've also got specifics to do with the necessity of any developer having to, first of all, read and then reference in their development our JSNA. So these will be live links in the published document. So as over the next 15 years, as our JSNA is refreshed and our joint local health and wellbeing strategy is developed and refreshed, they will be live documents, and the people proposing these plans will have to refer to them, and the council is committed to develop proposals that directly address those local health goals through the urban design process. So again, it's just emphasising the extent to which, at a policy level, health is written in, but also our policy levers or our statutory responsibilities as public health, as the public health duty at the moment, is written into this policy. Again, quite quickly, this is something I wanted to add just to illustrate how quickly policy is changing in this space. So when we were at the stage called Regulation 18, in conversation with my colleagues in strategic policy, I was very keen for us to have a public health test when it came to any proposals for hot food takeaways. And for good reason, colleagues were also committed, whilst having this sort of test in our policy, which is a really, it's a good test. It's also one that's 30 or 40% of local plans across the country has. Viability and vitality, so vitality and viability was considered a better test. We'd basically been able to use that well-established, robust method to be able to resist hot food takeaway applications in areas that we were concerned about, and we hadn't had recourse to this other test. But things changed quite quickly. I forgot about this slide. Basically, we as a local authority signed the Healthy Weight Declaration This is in the supporting text in the policy, and there's a recognition there that part of our ambition for the town is that we will provide healthier eating choices, and that management opportunity to do with walking distances from schools will be part of our strategy for controlling the food environment. But when in the summer of last year the Labour government came to power, they immediately said that they were going to do the national planning policy framework was going to be reviewed, and that they were going to request, and they did request at that point, that there was going to be a consultation process, which was in the summer of last year, which we contributed to as Public Health South Tees. And specifically, there was a consultation question, which was how could national planning policy better support local authorities in promoting healthy communities and tackling childhood obesity. That closed in September, and then a new policy came into effect in December of 2024, so actually December the 12th last year. And it's much more robust than the policy that we were preparing our previous local plan for. So colleagues in strategic policy had some reservations about having a public health test as part of the hot food takeaway policy, simply because historically they've been hotly contested by people like McDonald's and KFC for a whole range of reasons, too many to go into in this talk. But the government basically took on board ambitions that have been in Public Health England. OHID is now for 10 or 15 years. So we now have in policy this new statement. So we are to enable and support healthy lives through both promoting good health and preventing ill health, especially where this will address identified local health and well-being needs and reduce health inequalities between the most and least deprived communities. Now, as Rebecca said, Middlesbrough, the Northeast in general, but Middlesbrough in particular, is an area that really there are significant health inequalities that need to be addressed, and the food environment is one of them. And this particular new policy, so a lot of my time has been taken up over the last few months with understanding what this policy, this new single paragraph in the new policy at a national level, will mean both for us within Middlesbrough and colleagues in Redcar and Cleveland, but also what it will mean going forward nationally. So we're part, because of the groups that I'm a member of at the national level, we're coming to an understanding of what we mean by other places where children and young people congregate, as well as what constitutes a fast food outlet. So this is policy changing at a national level, impacting the way that we work at a local government level, and then working with colleagues across. So when this policy on the December the 12th once this was published, we could start acting on this immediately. So we did. We created, again with colleagues, both in planning at Redcar and Cleveland and planning in Middlesbrough, we've created this new data asset. So here you can see in the little black pins, they're all the current, they're basically their hot food takeaways or fast food outlets using the PHE OHID definition from 2018. The blue squares are our primary schools, the red our special schools, and the green our secondary schools. So if any if any prospective proposal comes forward now, we can use this data asset to first of all assess the distance from our schools. We've also got layers now that add community centres, parks, but also you can also see in the kind of gradated oranges in the background the actual obesity levels at the end of primary school. So it's overweight and obesity, and the national average there is 36.6%, and unsurprisingly, there's a clear inequality across our town. So if you look at the more salubrious parts of the city, you can see they're all below, well, they're all south of 36% for sure. And as you go north and east, you can see that the gradient is all above 36%, apart from that little island, which is, well, that's to do with the industrial nature of that area. So, very quickly talk about the HIAP approach and the HDRC here in South Tees. So since I came into post, I've been in correspondence with colleague Amelia Lake at Teesside University. So I have a research interest in stewardship of space and place. Amelia's interest is obviously in the food environment, but we're looking at the moment to build on work that Amelia and a colleague in environmental health here in Middlesbrough have done that will, so this is under review at the moment, about this other aspect of the food environment that will become an increasingly important part of public health approaches to the food environment, which is the development of dark kitchens. And so that's one area under conversation at the moment that might become a HDRC project with our colleagues at Teesside University. And then there's this other project that, again, with colleagues within the HDRC itself, we're looking at one of the developments we're doing in Redcar in Cleveland, this Eston Recreation Ground development, and we're possibly working with colleagues at the University of Liverpool, the LSE. We're looking at developing a proposal for an NIHR assessment and evaluation of the stewardship intervention. So basically the extent to which we can promote perceptions of safety at this space to do with lighting, the fencing, the way in which the space is going to be maintained, the way in which the space engages the community in its stewardship. And that too will become part of the HDRC, possibly, again, currently under discussion, the extent to which that could become a HDRC proposal. So finally, thank you for your attention. Are there any questions?